Hi, my name is Jordan and I'm an rtNOW employee. I'd like to share with you a time of a true rtNOW success. I was on call in the middle of the night and received a phone call from a skilled nursing facility. They had a trach patient that had suddenly developed respiratory distress. They couldn't keep his oxygen saturations up, and he was also having an increase in heart rate and very difficulty breathing. I was able to video conference in to not only assess the patient, but to talk to the nursing staff to get a full history and physical. After doing this, I came to the conclusion that the patient's tracheostomy was likely plugged off. I was able to use my unique skill set and the nurse's hands-on bedside techniques to teach them and walk them through a tracheostomy change. After the patient had a brand new tracheostomy in, he had a complete relief of symptoms. His oxygen saturations were coming up and he was no longer in respiratory distress. This is a true rtNOW success because I was able to work as a team with a nursing facility and we were both able to utilize our skills for the benefit of the patient. Without rtNOW, this patient could have likely ended up in the ER.
Hi, I'm Chris. I'm a respiratory therapist with rtNOW. I received a call today from a client with a patient in respiratory distress. I instructed the nurse to start the rtNOW app at the patient's bedside. Upon assessment, the patient presented with shortness of breath and he was very anxious. He was already on BiPAP and the staff was trying to keep him from removing his mask. His oxygen saturation was in the low 80s. I instructed the nurse to adjust the BiPAP settings and readjust the mask. I explained to the patient why he needed to use the BiPAP for a short while and tried to ease his anxiety. Then I suggested to the nurse to administer an anti-anxiety medication that the physician ordered as needed. Within a few minutes, the patient's oxygen saturation came back up into the high 90s. I stayed on the call for another 10 minutes to make sure the patient was stabilized, and I instructed the nurse to call back if there were any more questions. I feel that giving smaller facilities access to respiratory therapy services is a game changer. It's a huge advantage for patients and staff to have all the knowledge and expertise needed just a phone call away. I think everyone should have access to respiratory services, and rtNOW does just that.
I would like to tell a story about how rtNOW had a really big success in teamwork. We had a patient come into a critical access hospital and who was in respiratory distress. The team at the facility called rtNOW, and with the help of the nurses, we decided that it was time and this patient needed to be placed on a BiPAP. The team was a little unsure about the possibility that patient would be staying much longer because they felt she was too sick to be at that facility. Once we got her on the BiPAP and had made some adjustments with the help of the respiratory therapist via the rtNOW telehealth system, the staff felt much more comfortable and they admitted her to the hospital. So the part that I didn't tell you up to this point was that it was Christmas weekend. Christmas was on a Sunday. And in a normal case, this patient would have probably been transferred out much sooner. With the help of rtNOW, the patient was followed every 4 hours by our team. We had a good track with all of our RTs on the back end to make sure that they were communicating and also checking in with the facility nurses. We were able to manage her all the way through the weekend and started titrating her, I believe, on Christmas. So the day after Christmas, she was relieved of the BiPAP and was able to sustain her own. The biggest success that we had was working as a team on our end to support the facility and to serve the patient and her family. Normally, she would have probably been in a larger institution miles and miles away on Christmas, away from her family, but the family was able to spend that time with her in their town, and that was just an amazing story that I wanted to share with you.
Hi, my name is Jordan, and I'd like to share with you a time of a true rtNOW success. I was on call in the middle of the night and received a phone call from a birthing center. They had just delivered a baby via C-section that was struggling to breathe. Given that this was a rural facility, they had to transfer the baby to a higher level of care. But in the meantime, they really needed some help optimizing this baby's respiratory status. So they called me, and I was able to telehealth video conference and walk them through some simple steps to help optimize the patient's airway. We were able to position the patient, suction the patient, and apply CPAP so the patient was able to breathe easier. This resulted in the patient having stable vitals until the flight team was able to arrive for transport. This is an example of a true rtNOW success.